Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We had a lot of questions. As you know, I always tell you that to take good care of yourself and always talk to your doctors and let them know everything you're taking, whether it be your prescription drugs or whether you're taking over-the-counter preparations. And particularly, I always tell you to tell them about vitamins and dietary supplements, otherwise known often as nutraceuticals. So we had a lot of questions. I figured I'll bring some experts here. Sitting in front of me is Dr. Frederick Chaleff, right? With a hard E, right? And he's an interventional cardiologist at Westside Regional Medical Center. And he's the founder of Scimera MD, a bioceutical company. More importantly, at this point in time, I'm going to introduce to you a fellow pharmacist and a longtime colleague who is renowned really in our community of South Florida. He's the president and CEO of Pillbox Pharmacy and Medical Supply Companies. It's one company but multiple stores.
There you go.
Correct?
Correct.
Okay, welcome, Steve.
Thank you,
Good
Fred.
to see you, sir. Doctor, as an interventional cardiologist working at Westside Regional, I know there's a lot of work and a lot of involvement, and we talk about stents and interventional cardiology all the time. So, but what brought you to that company?
So what happened was, as people getting more and more knowledgeable about cardiovascular disease, they were taking their statins. I was getting a lot of questions relating what else could I take besides a statin for my cholesterol. So they're asking me about something that was natural. And when I would kind of review what was out there, I wouldn't see a lot of things that I was comfortable as a cardiologist to recommend. So when we did our research, we found certain nutraceuticals that had bioefficacy. So we looked at the data, we found that, and then I said, you know what, I can offer this to my patients. So we went ahead and developed what we call now as Prexator, which is a phytosterol that I was able to offer to my patients for their cholesterol to take it either on their own or in conjunction with a statin, and became very popular. And that's how we got involved in the nutraceutical business. And then one product started to lead to another, all based on clinical studies and efficacy.
Okay, well, I'm going to leave it at that point because I want to turn to Steve Pressman, pharmacist extraordinaire, who, Steve, knowing Pillbox Pharmacy, I know the extent of the product selection and the supplement selection and the, I would say, the nutraceutical selection that is available in your, I think you have 4 stores.
Well, Dr. Chaleff hit it on the head when he said that people are asking for more natural type products. So with the invention or the more education that we are finding out in these days and age with nutraceuticals or more natural products, there are many products available to help many symptoms of different patients. Along the lines of exactly what he was saying. People would rather start with a nutraceutical or herbal supplement than they would a prescription.
Well, but I know, and again, knowing of the very professional attitude in which you present in your pharmacies, because it's not, you know, there are no, and again, I have nothing against the majors, you know, but I mean, your F.A.C.C.P is healthcare products and durable medical equipment and a lot of other little things that are nice for people to see, certain gift products, whatever. But really the foci of Pillbox Pharmacies has always been the care of the patient.
Absolutely.
And I know there's a lot of consultation that goes on from your pharmacist to the, you don't really ask, you're not forced into OBRA. You're right out there, out front, talking to the patient. But there is an interesting thing because there is a lot of questions. These folks out here that really give us the topics for these shows are constantly saying, because I always tell them, don't just walk into a distributing venue, whatever it may, a supermarket, a big store, a large distribution pharmacy or otherwise, and just pick something off the shelf and not talk to somebody.
That's a very good point, because a lot of times we're limited with our time in the office. We'll talk about something, and then what happens is that they'll go to the pharmacy and then they'll have another question. They don't really call us back. So somebody like Steve in his pharmacy, they're always available to talk to the patient, explain what's going on, and therefore the patient feels a lot comfortable, as opposed to one of the bigger chains where they don't really have any access to the pharmacist and can't speak to them. So as a physician, if I recommend something and they send them, let's say it's a pill box or something, the patients I know would be very well taken care of after they leave my office. So that.
Well, you know, to be very candid, and I'm going to, Steve may not agree with me on this, but I'm going to defend some of these so-called, what you just called chains. They would get a lot more value for their costs that they're paying for their pharmaceuticals if they would only consult with people. If they're not getting a good enough answer from Steve Pressman and the pharmacists that work for him, then he might want to remand their attention to someone like yourself,
Right.
who is willing to talk to the patient.
And a lot of times he will take the time, or the pharmacist in this scenario will take the time to communicate with us. You don't see that normally elsewhere. And the consumer or the patient almost accepts the fact that they go to the big chains and they're not going to communicate. They're going to pick up their medications and leave.
Well, there's one other thing I want to bring to this discussion that goes a little bit beyond nutraceuticals and you know, plant-based products and animal-based products, which are now being distributed throughout what I would call very select pharmacies, very select. And to tell you the truth, some large venues like Whole Foods, I mean, is a perfect example. But I would say to you that it always bothers me, as my original profession of being a pharmacist, of watching people walk through a retail venue, whether it be a supermarket or otherwise, pick something off a shelf for cold, flu, cough, or otherwise, read the back, if they do read the back, and not understand what the back is saying to them. And they just walk up to the cash register and check out.
Well, that's an advertising and marketing component, that patients or customers, they see the product on TV, they walk into the pharmacy, they like what they see on TV, they go buy the product, and yes, they don't read it. And sometimes there are interactions.
Steve, don't you find it to be a bit disturbing to you in your professional realm?
When I'm not here doing this,
Yeah.
I'm at the store, helping people exactly like you said every day. And I built my business on helping people and telling them about their prescription, how to take it, what not to take, if they're buying something over the counter, if they need something for cough and cold. Myself and my pharmacists and staff that I've trained are out there helping them with their selection.
Yeah, I mean, because, you know, I mean, sometimes people say you shouldn't take it with X or Y, you know, whatever. There are so many indications, precautions
Right.
on these labels.
Sometimes there's
And how does anybody know what a monoamine oxidase is? How would they know?
MAO inhibitor, exactly.
Yeah, I mean,
They don't.
I mean, how would they know? I mean, it's not their fault. It's not these folks' fault. But I really think somewhere along the line, someone's dropped the ball. I don't know whether it's our fellow pharmacists, or whether it's the industry, or whether it's, you know, whether it's. I'm sure it's not the physicians.
it's the industry, it's society, it's the way it's morphed from the way you used to practice pharmacy. I still practice pharmacy the same way we did in the old days, because that worked best for the consumer. But it's society, and it morphed into everybody wants things fast and quick and easy and get me in and get me out, and they don't read labels.
They don't want to read
They'll
it.
just take it.
And a lot of it also, the FDA doesn't supervise the nutraceutical industry, obviously the way they do the pharmaceutical industry. So there's a lot of things that fall through the cracks also, especially with the quality of products.
Well, I'm glad you bring that up, because the number one question that people have asked us relative to supplements, vitamins and dietary supplements, is how do I know what to buy? Is it because do I buy something because it's less expensive? Is it on sale or whatever? I mean, we had a question that came to us recently about why should I buy CoQ10 that shows that it's from that it has ubiquinol in it. Mm-hmm. Now, I'm being a little technical, but there is a reason why.
Yes, yes.
You want to explain?
So 90% of the CoQ10 in the body is in the form of ubiquinol. That is the bioactive form. So when you consume the ubiquinol, the bioactive form, theoretically you're bypassing one of the transitional pathways in the body to utilize the ubiquinol much faster, or the CoQ10 much faster. So that's why there's an argument to take the ubiquinol as opposed to the CoQ10, which people, based on studies, have found that to be true. It is probably better. And I recommend ubiquinol for my patients for that reason. The ubiquinone, which is the CoQ10, which is actually the ketone form, is much cheaper. So you see a lot of that being marketed as CoQ10, partly because, yes, it is effective, but it has to go through enzymatic pathways to become bioactive. So as a cardiologist, if it's feasible, I tell them, try to take the ubiquinol.
Stephen, you hear that all the time. I'm sure the people ask questions all the time. I mean, I will tell you, not as a secret shopper, but about 2 weeks ago, I was in one of your pharmacies in Pembroke Pines, and I heard someone ask the question of one of your pharmacists, and the same answer came, the same exact answer. Now, don't you feel good about that?
Absolutely. I'm glad they're listening.
They are listening. Tell me about the...
I want to...
Go ahead.
When we talk about quality, because that's what we mentioned about quality and different products. Several years ago, there's a Prostate Formula. Somebody came in to me complaining about the price of my Prostate Formula that, from one of the companies, was much more expensive than where they were buying it at a vitamin store. Mm-hmm. I said, bring your product in, I want to see what it is. Now, in the same respect that Dr. Chaleff was saying, he came in with a bottle that had leaves from the saw palmetto plant in it, which has no bioactive ingredient whatsoever. He might as well have bought capsules with cut grass and put it in there. And he was and he bought it a lot less expensive in a vitamin store. And then he came to me, and I explained to him what we were selling was the berry extract that has all the properties to help your prostate in that. And that's why it was more expensive. Not that I was a lot more money, it was more that he was getting a product that was worthless.
Yeah, and get what he paid for. In answer to your question, just to reflect back a second, there are some guidelines, and we look for United States Pharmacopoeia guidelines. And that is very important, because if you follow those guidelines, you usually meet the purity, the standards, and the integrity of the components that are in there. And I'll give you a perfect example. Very typical vitamin A and C and E and D, they tend to oxidize. So if, let's say you see there's 100 milligrams of vitamin C in your tablet, let's say, then what'll happen is on the shelf it'll start to oxidize. So it's 100 milligrams at the time of manufacture, but over a period of time, if it stays on the shelf, it really degrades to 95 milligrams, 90 milligrams, and you don't get the true 100. When you follow the U.S. Pharmacopoeia guidelines, a lot of times what you do is you put overages in there. Those overages allow to maintain the same amount because of the degradation process. So let's say for vitamin C there's an 8%, you need to put 8 or 10% overage. So at the time of manufacture, there's actually 110 milligrams. Because we know that if it takes about 6 months to sell or 3 months, by the time it goes through distribution on the shelf to the consumer, you'll truly end up with the 100 milligrams that's on the label. But if you put overages in, that tends to increase the cost.
Doctor, you as an interventional cardiologist, I want to touch on this because one of the most commented areas of interest to our viewers is minimally invasive techniques. Mm-hmm. Obviously, as an interventional cardiologist, I'm sure that you're involved at all times with minimally invasive techniques, doing stents and things of that nature, correct?
Absolutely.
So you want to just touch on that for a minute?
So of course it's very popular because it is minimally invasive. We always try to pursue that route when it's medically best for the patient. But if a patient comes in with chest pain and let's say we're highly suspicious of coronary artery disease, we'll do an angiogram, usually through the radial artery of the wrist or through the femoral artery of the leg. We'll go in, inject contrast, see the blockage. Through this little hole in the leg, which is only several millimeters, we'll put a little tube in. Through the tube, we go ahead, put a little wire, which is only 14/1000ths of an inch, use that as a guide, and go ahead and place either a balloon or usually always a stent. We retract the wire, take out all the introducers, then they're only left with a little 2 mm residual scar, pretty much.
Now, the reason I bring it up is because I want to try to bring it to the subject matter, but I will tell you that ex post facto of this, I believe, and you tell me otherwise, that the patient gets to, there's a heightened interest, because now, oh, look what happened. I didn't have to have, well, with all due respect, there are wonderful cardiovascular surgeons around, and there's no way in putting that aside. Mm-hmm. But I mean, open heart surgery is diminished dramatically because of stents.
Yes.
But yet, when people come out of this and they are very happy about the fact that they've not had cutting, mm-hmm. bleeding, pain, etc. With all due respect to the wonderful cardiovascular surgeons, but they get very, very interested in how do I prevent this from happening again. And I hear it over and over and over again, and we get constant comments from people. That's why I brought up the CoQ10 issue. We get constant comments from people about who should we go to, who do we talk to about our nutrition, about our over-the-counter product intakes, over vitamins, dietary supplements. My answer is pretty simple. Obviously, you have to communicate with your physician, that's number one, but equally as important, communicate with someone with knowledge who happens to be a pharmacist interested in that field. Steve?
Absolutely right. And I am fortunately and unfortunately a recipient of one of those stents that Dr. Chaleff put in. Mm-hmm. And I started with him a few years ago, went to him as a patient. We scanned things out, exactly the procedure he said, and now I have a stent. And I'm asking the same question that you just answered. What can I do to prevent further stents? Or how do I eat, exercise, nutraceuticals? What can I do to improve my cardiovascular system to avoid having further stents or cardio disease?
Right, and you know, it's interesting because the whole field of food intake, we went through this nearly 15 to 20 year time of no fat diets, you know, this, and now it's quite different because there's the whole capability of understanding what causes a lot of this can be mitigated, not necessarily done away with, but mitigate the compounding efforts of the destruction of the ability of the cardium and the circulatory system, correct?
You know, you bring up a point how our fund of knowledge has vastly increased since all this started. The big question I get is, well, how can I have a heart attack if my cholesterol is almost normal? And what we found is when we looked further into it, of course there's many variables, but we look at the particle size of, let's say, the LDL, the bad cholesterol. We find that they're very different size. The smaller the size particles, which is very much genetically predetermined, the higher the incidence of cardiovascular disease or blockages. So yes, you may have a almost normal cholesterol, but your particle size are very small, your LDL, which is highly what we call atherogenic or likely to form a blockage. So we've learned that in those cases we get much more aggressive and try to alter that to some extent to mitigate or reduce the incidence of recurrent coronary artery disease. There was just a girl the other day, she just got married and she was having chest pain. She had a strong family history. Her cholesterol wasn't even that high, but she was genetically predisposed. She was 33 years old, ended up having a critical lesion right in what we call the Widowmaker lesion vessel, and she had to go emergency bypass. She probably would not have lived for another week had she not gone to the hospital. Only 33, and her cholesterol was not even that high. But again, that's a family genetic issue.
So just give me a general feeling about how your venue operates and how you deal with this.
Well, we over the years we've learned too, and when you speak to health professionals who manufacture, like Scimera MD and other companies that we sell at Pillbox, we go strictly high-end now. So I know if I'm selling you something, I would give it to my mother, my father, I would take it myself as being a high-quality supplement. And at some point, it's either going to help you, or if it doesn't help, we'll try something else. But I know by using the higher quality supplements, we're on the right track, as opposed to buying massive sizes of other nutraceuticals that you buy in big box places. There is a difference when you talk about quality.
Well, again, Dr. Chaleff made a point. Because the FDA really doesn't standardize, in many sense, the product lines that are out there in the nutraceuticals and dietary supplements, it's really going to be up to the ability of having someone who is an advocate, such as Dr. Chaleff, as well as a distribution advocate, such as yourself in your pharmacies, to give them the knowledge.
Give them a certain degree of education when
Right.
they're buying this. A lot of people have already read something somewhere, or somebody told them, or the physician told them, to get this or add it, and then they come to me and we'll further explain it to them and why this product may be better than a different one.
An ingredient is important to them, not only the brand
Exactly.
name or the bottle that it's in, but what is in the capsule or tablet.
But it goes hand in hand. You want, again, like I said before, you want quality. So quality with the education and the substance, yes.
And they get the education from the pharmacist, from the physician, and a lot from the internet too when they read. And they talk to their friends, which you don't know how accurate that information is. But once they talk to their physician and the pharmacist, I think they'll have the proper guidance.
Well, what I take out of it, and I guess, I haven't practiced, in quotes, pharmacy from inside of a pharmacy since 1986, but I'm still a pharmacist. And I in my mind, knowledge is the greatest strength.
Absolutely.
It overcomes ignorance, it overcomes a lot of things. But, having the ability of interdisciplinary and, shall we say, conversations, communication between health professionals, understanding one another, as we try to do here at Nova Southeastern, we feel that the patient is the one who receives the greatest benefits.
That's what we strive for.
That's what it's all about.
That's the bottom line.
we strive
I
for.
mean, it's not about putting money in my pocket. It's about helping people, which is why I got into the profession to begin with. Got into the profession so I could help people. And I do that every day now for 34 years in my own store, and I did that before I even started in my own venues.
Well, I'm proud of both of you for being willing to come forward and just talk about this subject. We're going to have you back because we want to talk about some items, specific items that we might want to get into. For example, there's a lot of controversy over, estrogen therapy and things of that nature, which are very complicated, but yet I think should be discussed. And we'll do that at some time in the future. I want to thank you very much, Dr. Chaleff. And again, you're at Westside Regional Medical Center. You're an interventional cardiologist. You're a neighbor right up the street.
Absolutely.
And the name of your company again?
Scimera MD.
Scimera MD. And Steve Pressman, what can I tell you? You're a neighbor. You're an old friend and a qualified and knowledgeable pharmacist, and I'm very proud of you.
Thank you very much.
Thank you very much
Thank
for
you,
being
Fred.
here. I appreciate it. And say hello to your wife, who happens to be a graduate of?
Nova Southeastern
You got
University.
it.
She's
You got
also an expert in hormonal.
I'm aware of it, but I want to bring, but we're going to bring that back because it's very controversial. Not for any good reason, but it's controversial. Anyway, folks, we want to thank you once again for allowing us to come into your homes. Remember, this is your show. Any subject matter that you want to bring up, just let us know. Any questions you want answered, there's an email address and a telephone number right here. And remember, as I always tell you, take good care of yourself. In this case, I'm going to underscore one more time. When you see your physician, you got to let them know what kind of vitamins, supplements, and over-the-counter preparations you're taking. They can't live in the dark. They got to know what you're doing. My name is Fred Lippman. This show is called Dateline Health. We come to you from Nova Southeastern University. Until next time, see ya.